Welcome everyone that has just arrived. We'll get started in just a couple minutes, and I just wanted to remind everybody to go ahead and mute yourself now, just so that we don't have any background noise. Hello everyone, and welcome to Medcom's desktop discussion. Thank you all for joining us today and for submitting your questions. I'm Mallory Hopkins, Marketing Specialist at Medcom, and I'm joined today by our Senior Legal Counsel, Michelle Barkey, whose years of legal and medical experience makes her the perfect person to answer our questions and address our concerns. I'll remind everyone to please mute yourselves, as we have a lot of information to get through today and would hate to be distracted by background noise. I'll go ahead and begin our Q&A at this time. Our first question today is, what is Medcom's position on dependent care accounts in the light of COVID-19 school closings? Participants who elected DCAs now anticipate spending less due to those closings.
Medcom does allow these changes in elections under the dependent care accounts. Unlike health FSAs, the provisions in the IRS regulations pertaining to the DCAP are comparatively more permissible, and they actually do allow participants to make changes in their payroll contributions based on the needs of the daycare and whether or not they change daycares. So unless the employer has deliberately and specifically otherwise limited the employees from changing the election amounts on the DCAP, Medcom certainly allows it. Then there was a second part of the question which was, will the 2020 benefits still be a use it or lose it, or will rollover allowances apply? Well, as far as the DCAP, we've already discussed that the DCAP participants can certainly change the amounts of the elections, and they should be watching that and doing so if the employer permits, so that they don't have a rollover, so that they don't have a use it or lose it situation. As far as the FSA is concerned, to date, we haven't received any formal notification or directive from the federal authorities specifically regarding FSA plans and the user will lose it. Employers can, however, during the plan year, change the run-out provisions, add the 2.5-month grace period, or add a carryover of $500. There has been no formal advice that more than the $500 carryover will be permitted, or that individuals can change election amounts in the context of the COVID-19 outbreak. There are some organizations that say you can change the FSA whenever there is a change in healthcare needs, but this is not supported at this time by any of the IRS regulations. Others believe that there might be an argument that there is an increase in cost or coverage, which could allow for a mid-year election change. This is a possibility, but it might be a stretch, and there's always some risk to that. And this has not been 100% clarified by the IRS in light of COVID-19. Medcom's belief is that federal agencies are so overwhelmed and so necessarily focused on other priorities. Consequently, the technicalities pertaining to these type of consumer-driven health and welfare plans are just not on their radar. That being said, based on all the other actions of our federal government, including the IRS, during the onset of this pandemic, we do believe that a common sense flexibility is the acceptable course of action. There is some risk, but in light of COVID-19, we believe that 2020 will be a year of forgiveness and discretionary enforcement. But we always like to advise employers that there is some risk, no matter how low. Mallory?
Thank you, Michelle. Our next question is, can an employer have a grace period, as in send unused FSA money for 2.5 months into the next plan year, and a $500 rollover in the medical FSA program?
No, they have to choose one or the other. You can't have a grace period and a carryover. It's either one or the other.
Okay, our next question is, will there be a complete listing of OTC medications allowable? Does this provision go back to the original OTC allowable rules?
That is a really, really good question. And at this time, there is no listing. I would imagine the IRS will clarify in time, but for now, just go with over-the-counter drugs and the menstrual products, which are also allowed now. I would also look to the FDA for guidance as to what an OTC is and what it is not. The FDA actually classifies an over-the-counter drug as a drugs that are safe and effective for the use of the general public without seeking medical treatment by a professional. They are regulated actually by the Office of Non-Prescription Drugs at the FDA, and they have the following characteristics. The benefit outweighs the risk. The potential for misuse and abuse is low. Consumers can use them for self-diagnosed conditions. They can be adequately labeled, and health practitioners are not needed for the safe and effective use of these products. Now, here's the caveat. Since the FDA does not approve the pills you see in the healthcare stores, I do not believe that these will be considered under the definition of OTC, and certainly not under the FDA's definition of the OTC. So therefore, I would not consider all those pills you get in healthcare stores as part of the new benefit that the government is giving us at this time.
Okay. The next question is, for the portion of the CARES Act that addresses small business resources, such as short-term loans, payroll protection, etc., can you provide a high level of information on the plans?
Okay, certainly. And actually, there's two different types of plans that we're talking about here. The first is the Paycheck Protection Program, and it's going to be administered by the Small Business Association, and according to the IRS, and the loans are going to be available starting tomorrow, April the 3rd. The Paycheck Prevention Program provides small businesses with funds to pay up to 8 weeks of their payroll costs, including the benefit costs. Funds can also be used to pay for interest on mortgage, rent, and utilities. However, in order to get the forgiveness of the funds that they are providing, 75% of the money has to be spent actually on the payroll, and only 25% can be spent on the other funds that are available for the mortgage and the interest and things like that. But this loan will be forgivable up to 8 weeks for the payroll. No collateral or personal guarantees are required. Neither the government nor the lenders will charge the small business any fees, and they must keep the employees on the payroll. That's the caveat, or rehire quickly. Forgiveness this loan forgiveness is completely based on the employer maintaining that payroll and not having as many employees run out to the Unemployment Insurance Bureau. All small businesses eligible, they are the ones that have 500 or fewer employees, including nonprofits and veterans organizations, tribal concerns, and self-employed individuals, sole proprietorships, and independent contractors. They're all eligible. Business is with more than 500 may be eligible in certain industries, and they've also relaxed the rules on affiliated groups and potentially a franchise ownerships. So that's what you're looking at if you are a small employer. They have a second one, which is the employer retention credit that is available to all employers regardless of size. And this also includes tax-exempt organizations, and there are a few qualifications. The employer's business is fully or partially suspended by the federal government or a government official in order or due to the COVID-19 during this calendar quarter, and the employer's gross receipts because of this are below 50% of a comparable quarter in 2019. And then once the employer's gross receipts go above the 80% of the comparable quarter in 2019, they will no longer qualify for the benefit. So we've got something for the large groups as well as the small groups. The amount of the credit in here for the large groups is 50% of the qualifying wages paid up to, I think it's $10,000 in total. Wages paid after March 12th and before January 2021 are eligible for the credit. Wages taken into account are not limited to cash payments, but also include a portion of the cost of the employer-provided health care. So, as I say, the small businesses will have a protection plan, the payroll check protection plan, and the larger businesses might be able to participate in this other type of benefit arrangement from the federal government. But we do have protections out there. And also, as you know, these small businesses are also subject to the Families First Coronavirus Response Act, which includes paid sick days and expanded family medical leave. And those benefits are also receive some tax credits from payroll taxes. So there's a lot of programs out there to participate in. So I hope that answers the question.
Yes. Do we know when the Department of Labor will publish the forms for sick leave?
Actually, we don't. They originally stated that the IRS was going to be the ones that were publishing the forms, since it would be the IRS that has the tax credits attached to the forms, and this is for the Families First Coronavirus Response Act. I have not seen anything from the IRS yet, except that they have given some more indication on the IRS side. And basically, what the IRS said is that an eligible employee will substantiate eligibility for the sick leave or family leave credits if the employer receives a written request for such a leave. So now the employee has to request that leave in writing, and which the employee provides the employee's name, the dates or dates for which the leave is requested, a statement of the COVID-19 related reason the employee is requesting the leave, and written support of such reason, and a statement that the employee is unable to work, including by means of telework or for any such reason. So I guess forms can be completed based on those 4 criteria. And then the IRS went on to say, in the case of a leave request based on a quarantine order or self-quarantine advice, the statement of the employee should include the name of the government entity ordering the quarantine or the name of the healthcare professional advising that self-quarantine is needed. And if the person subject to the quarantine or advice to self-quarantine is not the employee, that person's name and the relationship to the employee should also be attached. In the case of a leave request based on a school closing or child care provider's unavailability, the statement from the employee should include the name and the age of the children or child that they are caring for, the name of the school that has closed or place of care that is unavailable, and a representation that no other person will be providing care for the child during the period for which the employee is receiving the family medical leave with respect to the employee's inability, and then that the employee has the inability to work or telecommute because of the need to provide the daycare for a child other than for a child. And then they said for a child older than 14, they need to get a little bit more of a statement that specifies why they need to take care of that child during the hours. So the IRS has come up now with some indication, no formal form, but certainly enough information that forms can be developed based on that.
Okay, the next question is, our team has discussed the idea of the COVID-19 updates to FSA, HSA, and other tax and ERISA-related materials. Will this require amendments to WRAP and Flex Cafeteria Plan docs? Is there any agreement language that can address the temporary situational concerns?
Yeah, we are getting a lot of questions as to when to update the plan documents and what to do with the plan documents. The first thing to do is always decide what you are changing and if it's already covered in the plan document. For an example, when it comes to the change about the over-the-counter drugs, and employers don't have to agree to that. They can say, no, we're only going to cover the prescription drugs. But if they decide that they want to cover the over-the-counter drugs, then one of the things that you need to do is to see what your plan document already says. For an example, in Medcom's flexible spending account documents, typically it says, this health flexible spending account is intended to qualify as a medical reimbursement plan under Code Section 105 and shall be interpreted in a manner consistent with the code. So since the code is now allowing for those over-the-counter drugs, you don't have to put in something specifically that says over-the-counter drugs. So that's one of the things that we get a lot of questions on. And I always say, go back to the plan document you already have. We are also advising clients that the rules are coming down fast and furious, and the last thing you want to do it necessarily is change a plan document 20 times as more rules come in and more changes are made. So one of the things to do also is to look at the plan document and what it says about eligibility. And when you look at the plan administrator section, quite often it says that the plan administrator has discretion to approve eligibility. So at that stage of the game, what I would do before I try to run out fast and change a plan document is the plan administrator could just document, we're in the middle of a COVID-19 crisis, and because of that, we've allowed such and such and such and such change to be made. And then at the end of the day, we can always go and amend documents if they need to be done. But the thing I don't want to have happen is more confusion because of many amendments to a plan document than having the plan administrator document everything as she can if it's in their plan document already that the plan administrator has discretion, and then advising of the plan documents later. So that's basically what we're saying. Some things do need to be changed, though, if the plan documents are not clear now or if they don't have the added wording that some of the documents may not have. But first thing, check your document and check what you're trying to change, and then determine whether or not the plan document has a space where it's already covered.
Okay. If a client receives a letter that COBRA dental coverage will be terminated April 30th, 2020, can it be extended through May or June as the dental appointment they had in April was canceled?
Okay. That was also a really good question, and it's also a question where you have to actually look at what the law says and what the COBRA administrator does. The COBRA administrators always administrate by the law, and there is no support at this stage of the game for continuing COBRA under that federal law. And the COBRA administrators just can't go and say, okay, we're going to do this. I wish they could, but they can't, because at the back end, you have the carrier, and it's going to be the carrier who's ultimately going to decide whether or not that they would allow for continuation of coverage. They're not required to under the law. And it would be nothing worse than saying that the COBRA carrier would say, the COBRA administrator would say, okay, we'll take your premiums and then submit it to the carrier who says no. So the first thing to always do is check with the carrier and what the carrier is willing to do. And then with that, get that in writing and then go back to the COBRA administrator and see if they'll continue to take the premiums for as long as the carrier agrees. But I have not heard that dental carriers or vision carriers are continuing the coverage beyond COBRA.
Okay, and we also, thank you, Michelle. We also got a question in the chat, which says, can HSA compatible HDP plans waive employee cost share on COVID-19 services like inpatient stays?
I believe that they can, but what I want to do is take a look at that one more time. I know that they can on certain things, but I will take a look at that. I know the government did pass out a law regarding HSAs and high deductible health plans regarding COVID-19, and I'll just take a look at that a little bit more carefully to see whether it includes inpatient hospital stays. I know it includes vaccinations and a few things, but I don't know about inpatient. So since we've got that in the chat, we will certainly include that in the questions and get that answered after the end, but it will be included in the desktop discussion that you get.
Great, so we'll include that in the next one. Thank you, Michelle.
Yeah, but we'll actually include it in this one. We'll just add the question and answer it, and so that they'll have it in the hard copy when they get this one.
Great. Thank you.
Any other questions?
I believe that was the only one that was in the chat. Yes.
Okay. Thank you.
Thank you, Michelle. And thank you all for joining us today. That's all the questions that we have. Please remember that we'll be back here next Tuesday, April 7th at 10 a.m. for the next desktop discussion. You can submit your questions to COVID-19 questions@medcombenefits.com. We'll send out the full list of questions and answers from today's discussion by the end of the week. It'll include that question that was in the chat as well. And everyone have a wonderful day as always, and let us know how we can help. Thank you.